Now we start ultrasound of pancreas. Here we see a splenic vein and confluence of superior mesenteric vein and splenic vein. Here the superior mesenteric vein and splenic vein unite to form a portal confluence. This is a superior mesenteric artery. Now we see the uncinate process of the pancreas. This is head of pancreas, and this is neck of pancreas, and this is body of pancreas. Now if we focus on the head and neck and body, we see there is a heterogeneous texture. The head and neck appears to be echogenic and body is hypoechoic. Now if we see here, the head and neck is more echogenic. This pancreas is lies just below the left lobe of the liver and anterior to the splenic vein. When patient feels pain, epigastrium and tenderness, it means there could be inflammation of pancreas. And when we ultrasound this area, patient becomes irritable. It suggests that the inflammation of pancreas could be evident. Here we see the duodenum, which lies over the tail of the pancreas. Now we will give subcompression effect and the gas will be subside, and then we will see the tail of the pancreas. Now we will see the tail of pancreas. Here we see the tail of pancreas, which is not clearly visualized. Here we see the minimal collection in the tail of the pancreas, and there is gas shadows of duodenum. Now we see the fluid in the tail of pancreas when we rotating the probe from other side. Here we see a echogenic area in the tail, which also show inflammation. If we see the peripancreatic area of tail, which is echogenic, as more inflammation is here, the size of pancreas is appear to be normal, which is approximately between 2 into 2.5 centimeter from uncinate process to the tail of the body. The peripancreatic tissue at the head, neck and body are also echogenic due to inflammation, but no collection or fluid seen at peripancreatic area. The common cause of inflammation of pancreas are gallbladder stones. Now we also See that in gallbladder there is multiple small calculi. The walls of gallbladder are approximately normal as it is contracted. CBD is also normal. This is portal vein and this is CBD. Now how we will write report. The pancreas is normal in size. The uncinate process is also normal. The head, neck, body and tail of pancreas shows heterogeneous structure with mildly increased echogenicity. Minimal collection also seen in the tail of pancreas. Peripancreatic tissues are also mildly inflamed and echogenic. Gallbladder is partially contracted and contain multiple small calculi. The walls of gallbladder appears to be normal. Common bile duct is also normal. The ultrasound diagnosis is acute pancreatitis and cholelithiasis.